Nearly 2 out of 3 Indiana residents know someone battling addiction, according to a new study by Indiana University. IU is responding to these findings by hosting a free event tomorrow to help arm everyone with a life-saving tool. Today I spoke to a man who says hope is what drives addicts to recovery, and that hope is seen in Narcan. Meet Andrew Gaddy.
I am an addict myself in recovery. December the 11th, I have 12 years. I actually had 25 years of active addiction. Which was alcohol, cocaine, and heroin.
Here at the IU Health's emergency department at Methodist Hospital, he is known as Drew, a peer recovery coach helping addicts when they land in the ED. Many of those patients making it to the hospital because they use Narcan.
If it wasn't there, I wouldn't be able to tell you that they're still here today. So as long as they're here, there's still hope. And that's the big thing. There's hope.
Naloxone, also known as Narcan, is a drug used to treat an opioid overdose. For many, it's a second chance to live.
I'm just glad that it's there, so when they're given these chances, may not be the first time, may not be the second or third or fourth, but there's still time.
Dr. Dallas Peak has seen the opioid epidemic plague too many families and says Narcan can save lives.
Narcan is essentially a life-saving therapy that can be administered by anybody on scene to help reverse the effects of opiates.
Opiates enter into the bloodstream and latch onto brain receptors.
While they're bound to these opiate receptors, essentially what happens is it starts to shut us down. When we go to sleep, actually worse than that, we actually can stop breathing. And that's why people die from an overdose.
But naloxone has the power to reverse a life-altering overdose.
What Narcan does is it enters the bloodstream, goes to the very same receptor, and actually knocks the opiate off and binds to it extremely tightly in order to reverse those side effects.
Dr. Peak says someone who is not breathing can start to die within 5 minutes. Narcan starts working within seconds to help reverse that process and save a life.
It's like insurance. It's better to have insurance and not need it than to need it and not have it. Every house should have some because you never know when that time comes when you're going to need it.
Both Dr. Dallas and Drew have the same plea for everyone to carry Narcan and learn to use it.
Lives are valuable regardless if they're addicts or not, because it's a mother, it's a son, it's a father, they're someone's kids.
And tomorrow morning, free naloxone kits will be provided by IU Health staff at these locations across Indianapolis starting at 9 a.m. This Narcan distribution will also include a 20-minute training conducted by Overdose Lifeline. Now take a look at this. This is what you will receive, one Narcan kit, and this is what is inside. Dr. Peak says when someone has had an overdose and they can wake up and start breathing on their own with Narcan. So the most important thing to remember, if that happens, you need to still call 911 because there are a lot of things that need to be done to help that individual. Also important to note, these kits purchase can cost anywhere from $60 to $100, so this is a very good option.